My name is Pelle. I'm from Denmark, and I'm here to present the Fitforkids Childhood Obesity Intervention. Being obese as a child has serious negative effects on your health, on your social status, on your emotional well-being, on your income level, and your educational level. In the words of Aristotle, it is so that the whole is greater than the sum of the parts. And this is also true for the obese children's life quality, as they report of the same life quality as that of children with cancer. 6.5 million children in the EU are either obese or overweight, and it's not a problem that is going to go away on its own, because 70% of the children will remain obese or overweight as they grow old into adulthood. So globally, this trend has just grown and grown, and it has put a tremendous strain on national health budgets, and it costs billions of euros in treatment every year, and is related to several million deaths. Of course, all our European institutions have a focus on this, and we know that high-profile macro-level initiatives such as a tax on soft drinks or a differentiated VAT on vegetables would be a good idea, but we must also understand that we cannot win this battle against obesity without what we call boots on the ground. And in this case, that means community-based interventions. And that actually means warm hands reaching out from people who cares. Now, we look at who are providing a solution to this massive problem. We find that the market, it's not. There are really no grand-scale, commercially driven solutions. And that is probably because the families that needs the help the most cannot afford to pay for this. If we turn to the public sector, we find that most solutions are based on existing structures, such as hospitals or local health professionals. And they consist almost always of nutritional advice given at the hospital and with 3 months intervals, and there are no contacts, no support, no training, no materials for the families in between there. Obviously, these solutions from the public sector are not extremely attractive or popular with the families, and they are not that effective either. If we turn to research and look at what research says is effective, we know from meta-analysis of more than 100 different children's or childhood obesity interventions that they have to be comprehensive, long-term, and they also have to be multifactorial. And of course, that means that they are going to be expensive. And as it's been mentioned before, there is a strain on national health budgets, so it is not likely that governments will find the funding to roll out a solution on a national scale. So what do we do when we have a problem, a social crisis that neither the market or the governments can solve? Well, fortunately, we have this, the social innovation, where the people stand up. And Fitforkids is just that, a true social innovation. Founded by a small group of concerned parents and health professionals, social in ends and social in means. Founded in 2007 with the sole purpose to deliver the best possible childhood obesity intervention that we can come up with. So what did we come up with? Well, we listened to research. And we added the most comprehensive toolbox I have ever seen any intervention have. We made all our written materials available on our app for easy access for the families, and we learned from the best, because we learned or realized that a childhood obesity intervention is in fact a children's product, much like a toy, a chocolate bar, a cartoon, or even a video game. And if any of us are to sell something to a child, we better make it either fun or cool, and preferably both. Now, we've woven that into the DNA of Fit4Kids, trying to make every aspect of what we do fun, colorful, and energetic. Does it work? Yes. Fit4Kids has been tested at the National Hospital of Denmark. We had the honor of having the former chair of the National Public Health Council in our board for 4 years, and she was instrumental in testing Fit4Kids. And we came out with the best results of any childhood obesity intervention in Denmark ever. You can see here how public sector solutions are 12 to 15 times as expensive as the results delivered by Fit4Kids. And our secret recipe is our many volunteers. We can add a massive amount of human resource into the intervention at very, very, very low cost. That is the essence of the social innovation. Of course, we have to recruit. Of course, we have to educate and organize, and this is what we spend a lot of our donations on. We do that on instructor camps, and we don't find it that difficult to attract young students of health or nutrition because they get valuable hands-on experience that can help them compete in a difficult job market. We also support their efforts through our instructor app, allowing us to collect critical performance data and ease and support communications with families of many cultures, and also to keep a personal contact with our instructors on the most preferred platform, the smartphone. Our customers are not the families. Fit4Kids is for free. Our customers are government, municipalities, charity foundation, and national companies. We're founded, among other, by the Crown Princess Foundation, and we had the honor to have them come visit this June. We're in 12 cities, have educated 150 instructors, and had more than 1,000 families through the program. I'm here because I believe there is a European perspective to Fit4Kids. The next step for us, if we should be awarded a prize here, would be to package Fit4Kids as a franchise and contact relevant partners. Ladies and gentlemen of the jury, obese children are not used to being picked for the winning team. Let's change that today.